skill acquisition is a vital part of histology education. At Keele, histology is taught throughout years 1 and 2 to act as a bridge between the study of gross anatomy and physiology, and to provide a basis for the future study of pathology. I'll start by briefly introducing the challenges I faced when teaching histology to medics, the tools I developed to overcome this, and the 3 phases of application of these tools: in the face-to-face sessions, as online resources, and then modified resources in response to feedback. In Year 1, we cover the majority of body systems across semesters 1 and 2, in line with the study of gross anatomy in the dissection room. This comes to a total of 43 tissues, which, when you start to introduce them all with H&E staining to first-year medics, can become a bit overwhelming, and this is the phrase most often used by the students. When I joined Keele, I taught myself histology so that I could teach the students, so I started to think about what helped me to learn this content-heavy subject. The easiest way for me was to identify key differences between tissues and almost play a game of guess who. So I devised a decision tree that isolated the key features of each tissue and allowed their differentiation from other tissues. So, for example, if it was a solid tissue, you then look at how much cytoplasm is present, and whether there are ducts present, and the range of staining seen, to ultimately narrow down the options into just one tissue. In the first cycle, I introduced the use of the decision tree in the practical classes. I presented the students with an unknown tissue slide, and we discussed whether it was solid, hollow, or a surface. Once we decided it was a solid tissue, we talked about what tissues it could be and ruled out any hollow tissues or surfaces. We then looked at key features at low and high power to identify the tissue as the submandibular gland. 96% of the students agreed or strongly agreed that the tree was helpful. Feedback focused on the simplified nature of the tree that developed their ability to notice differences between tissues and link structure to function. In Phase 2, I created a Google site to provide support outside of the face-to-face sessions. I chose Google Sites because at this stage, Keele used Google as the host for emails, and as such, this allowed me to restrict access to Keele students. In this phase, only some of the features shown here were available, and I will tell you a little more about these now. One of the very basic things that I included was enlarged versions of the decision tree, subdivided by core tissue shape and presence or absence of key features such as ducts. I also created worked examples within Google Forms, and initially there were only 3 provided. These showed the students the questions from the decision tree applied to a specific tissue. 67% of students found these worked examples helpful, and 83% stated that they allowed them to correctly identify more tissues. The site also hosted 2 quizzes, which provided a necessary opportunity for formative assessment. Students were instructed to complete Quiz 1 prior to using the decision tree and worked examples, and then to complete Quiz 2. Quiz 1 consisted of 8 tissues, which students had to identify from a list of 5 options, similar to an MCQ-style assessment. The students were provided with immediate feedback on both correct and incorrect answers. The average for Quiz 1 was 53%. The average for Quiz 2 was 70%. In response to in-phase student feedback, I created Google Slides showing how to correctly use the worked examples by pointing out key features in a specific tissue. This improves students' perception of their own ability to identify tissues and their Quiz 2 scores. At this stage, Keele moved away from using OSCEs for first and second year students. However, previously, histology OSCE stations assessed students' ability to identify and describe key histological features in an unknown tissue slice. The introduction of the decision tree in Google Sites improved tissue identification from 46% to 81%. In the final phase, several new additions were made to the Google site to maximize the support available for the students. Students were provided with some foundational knowledge on the 4 core tissue types and how tissue is prepared for histological viewing. I also created a private YouTube video showing students how to correctly set up the microscope, supplemented by step-by-step written instructions. I also created a tissue database, which showed the questions from the decision tree applied to a variety of tissues, again highlighting the key differences between these tissues. Developing the skills to be able to apply knowledge is a vital part of a content-heavy subject such as histology. These skills were developed through the provision of the decision tree, worked examples, explanations on how to use the worked examples, and the tissue database. These newly acquired skills were then supported by opportunities for formative assessment with immediate feedback, thus encouraging assessment for learning and to identify areas of misunderstanding. Thank you for your time, and please feel free to ask any questions.